All right, well, good. Well, I think we're gonna get started here. Speaking of started, welcome everyone. This isn't how to drop all of your R's if you live in New England. This is this is the BioRaft EHS community webinar series, and today's is Delta variant weathering the storm question. And so we have with us four wonderful panelists who are going to do their intros in a minute on who they are. And we're just looking forward to having a wonderful conversation with you all. So we'll be talking amongst ourselves for probably 45-ish. And feel free during that, you can put conversational stuff in the chat. The chat tends to scroll quickly away depending upon how many. So questions that you do want to ask, enter them at any time that you want. You don't have to wait. Post them in the Q&A, and that will help sort them and all of that. We may address some as they come up if it fits in, but definitely we'll transition at about 20 of to quarter of the hour to the Q&A and do that up till about 15 after, depending upon how long everyone can hang out and how many questions we have. So that's good, and a good showing here today. All right, so again, welcome. And I'm Jonathan, and I'm our Director of Risk Management for BioRaft. And I feel like saying, hi, I'm Jonathan. I'm an EHS professional, right? Like we're at a 12-step meeting or something like that. But had a wonderful time over a long career and just having fun creating this content for you all. I'm going to go around in clockwise order just for me and ask our panelists to introduce themselves. And so, Elena, would you mind starting?
Hi, thank you, Jonathan, for inviting me to sit on the panel, esteemed panel. My name is Elena Capsuto. I have a graduate degree in epidemiology, and I've worked as an epidemiologist for the Texas Department of Health. I have experience in higher education. I used to work as an occupational assistant director for the University of Texas at Austin. I also have experience in the private and municipal settings, as well as with union environments. Thank you.
Thanks so much, Elena. Beth, can you go next, please?
Absolutely. So I'm currently executive director for the Nova Southeastern University in Florida, although we have 9 campuses and 1 in Puerto Rico. This is my 3rd university. I love working in higher education. I was previously at Princeton and also Villanova University. Villanova University. So 2 Novas. I was at Villanova University and at Nova Southeastern University. And prior to joining NSU, I actually worked at a nonprofit research institution that specialized in select agents, tier 1 agents, in emerging infectious diseases. So it's kind of paved the way for where I am today. It's great to be here, Jonathan. Thanks for inviting me.
Oh, absolutely. Thank you so much, Beth. All right, Lou, you're next on my screen.
Thanks, Jonathan, and welcome everybody. It's my pleasure to be here. I'm currently the director of the Environment, Health, and Safety Office at the Massachusetts Institute of Technology. And in addition, I'm an instructor in industrial hygiene at the Harvard School of Public Health. And so I grew up as an industrial hygienist like Jonathan, but have expanded into more general EHS activities. And pleasure to be here.
Thanks, Lou. Yeah, Lou and I grew up together. We're brothers from another mother or something along those lines, I'm pretty sure. All right, NK, please, Dr. Paisley, batting cleanup for us.
How you doing, everyone? I'm Dr. Paisley, or K. I'm very not formal. I am the director of occupational medicine at the UC Davis, as well as a professor at the School of Public Health here. I'm also, it didn't show on the screen, I'm also a chief preventive medicine officer for the Air Force in the 190th. I've been doing public health, occupational medicine for 20 years. Been doing it nationally and internationally. So this Delta variant thing is unfortunately not new to me in terms of a pathogen causing havoc, but once again, thank you for having me here as a panelist.
Yeah, thank you all. This is great. And I think everyone can see why I was just very excited by getting these 4 friends to join us here and share their expertise. It's really wonderful. So let's just jump right into it. Let's talk about some of the challenges. No one really had a playbook. Yes, as Kay was mentioning, public health, we've been dealing with a lot of pandemic or pandemic-like things for many years, but this one seemed really fresh. And now with the Delta variant, it really changed the landscape and made it more of a challenge in many ways. So without some sort of playbook, how did you each really figure it out on the fly? And, especially with these frequent changes that we've had. And I'm going to keep mixing up my orders here. So I'll actually reverse the order, I guess, and I'll start with you, Kay, if you don't mind.
No problem. So it's funny you talk about Trinidad before we got on this call, because one of my first assignments working internationally was in Trinidad, and it was to help address the H1N1 pandemic there. I used some of the skills that I acquired during that time period with this COVID. So one, I'm not Trinidadian, American Jamaican. And then one, you have to collaborate with individuals, the stakeholders, especially if you're an outsider, and try to calm the fears of everyone that's there. And that's exactly what I did during the beginning of the pandemic. Find out who the stakeholders were for, in my case, was Yola County Public Health, the students, my counterpart on the student health side, as well as various other administrators and the med center that's about 10 miles down the road, and try to come up with a game plan on how to mitigate the risk that was this COVID that was occurring like 18 months ago.
Yeah, great. Thanks so much, Kay. I can't remember the order, so I'm just going to go by my screen. Beth, we're going to do a lot of this. Don't worry, folks. I'm trying to keep you all right on target here, paying attention to me, I guess. Beth, do you mind going next, please?
Sure. So,
Yeah.
we're talking about challenges and navigating those. And you're right, it would have been really helpful to have had a playbook. We didn't have the benefit of that. And I think we all faced a lot of similar challenges of struggling with obtaining PPE and all of that. But I'll just share with you one of those surprising challenges that I guess I knew, but was shocked at how frequently we encountered the challenge of communication, accurate communication, accurate information sharing, with the guidance frequently changing. There was a great deal of confusion. So among all the traditional challenges, we all sort of felt together collectively, right, with just navigating the unknown. One of the greatest challenges for me, in addition to that, was just the great challenge of communication. And I learned a lot about how to improve that. And then one of the other challenges, I really appreciated what Kay said about collaboration, the need to collaborate, the need to assuage fears. And then I do not like to disappoint people. I like to make everyone happy. And you can't do that in a pandemic, and you have to let people down. And it was really disappointing and challenging for me to have to tell people we're canceling spring break, we're canceling graduations, we're having to make these tough decisions for the greater concern of everyone's well-being and health. And so that was challenging for me. So I'm not really sharing specifically navigating through the pandemic, but just some of the challenges that maybe were more what I considered difficult in the pandemic.
Yeah, good. Thanks. Okay. And Elena, please.
Thank you. I'm going to echo some of the things that Beth said, that communication, especially dealing with critical infrastructure employees who don't necessarily have emails, that was a challenge. Also, union environments when dealing with critical infrastructure such as police and fire, is it really, when we made requirements such as certain requirements for PPE and N95s, it really triggered potential changes to collective bargaining. And then the tremendous fatigue people had who were working long hours on IT, critical infrastructure, our facilities folks, for all the ash rate changes that I suggested that we implement. So it really is a holistic approach of looking at and partnering with the local health authorities and consensus organizations like ASHRAE. But so I'm going to echo the things that Kay and Beth have said.
Yeah, excellent. All right, and Lou, what about for you at MIT?
We were able, I think, to cope primarily because the Institute has a pretty good organization that fosters and encourages collaboration among many units, administrative units, as well as with the faculty. So between our medical department and our facilities group and faculty who are experts in infectious diseases or modeling of HVAC systems, I think we were able to hit the ground running. The thing that probably was the most difficult for all of us, I suspect, is just a lot of unknowns particularly in the early stages. And hopefully we will learn from how to better cope with those unknowns as well. You'll hear that theme, I think, probably throughout the day today.
Yeah, definitely. So you're all talking about communication. And so let's explore this a little bit here, working with different groups of people. So, for several of our panelists, they're on higher ed, they're on campuses, but all have done work outside of that as well. And Elena, of course, doing a lot of other work outside of that. So I'd be curious on your strategies when it comes to communicating with the different groups, right? Like Elena mentioned, the union environment and the people who have to still be at work, like police, of course, Kay doing that. And I'm sure that all of you and many of you on this were the folks that had to be there and all. So maybe we can just each, spend again another minute-ish each. What was a good tip or what was a challenge or whatever? How did you find it working with these different groups of stakeholders? And to give everyone a quick forecast after that, probably going to start to wade into this issue of risk perceptions. So if you want to dip your toes into that area, feel free to do so. And I can't remember. I'm going to start with Elena this time, I think.
Well, that's a great question. I can tell you that with working with one of the local municipalities, one of the challenges was our facilities group, who are not email, don't sit in front of their computers. So we did it at the morning meetings, but unfortunately, we had an outbreak because this was the one group that we had given a lot of hard copies to, and they had spent more than 15 minutes. The supervisor had tested positive. So it was a big challenge with our non-computer groups like facilities that did live in-person meetings, especially in the beginning. So that was one of the bigger challenges. And we created lots of hard copies, when you go into buildings and in the break rooms and the bathrooms, and then sometimes in different languages when dealing with the different members of the public.
Yeah, I think that's a great way to do it, including right there in the bathrooms, right? Where people typically are going to eventually migrate to, and they're going to see whatever that messaging is. That's great. Lou, how's about you next?
So I think, as I mentioned, I think we have a pretty good organization, and that organization is helpful in communicating across all lines. We also, unfortunately for us, just prior to the pandemic, we had gone through actually a couple of crises, not related to this, which I won't describe, but as part of that, we had to shore up our communication methodology. And that helped us. We learned from that. I guess the one frustrating thing, at least for me, was when you have a good communication process in place, basically a lot of communicators, there can be a lot of delay in time for umpteen people to review the communication before it's released. And so I would hopefully try to streamline that as we go forward.
Great. All right. Kay, from your perspective there.
So earlier part of the pandemic was a little rough for us. There was no real information about this virus. We actually had to take a lot of data from the new virus, from SARS, which was its cousin.
Mhm.
And we had to create a lot of protocols utilizing science from that virus and trying to communicate to the population what we're doing was a little problematic initially. One, because it was like, why don't you have any information on it? Because it's a novel virus. And it was dealing with the communication was a little difficult initially because there was a lot of fear, and we had to keep repeating the information, and it was painful as a scientist and a clinician to literally have to say the dreaded words, "We do not know, but we will get back to you."
Mhm.
And I think the sincerity and just actually telling them we don't know, but we will keep at it, kind of ease things a little bit. I think that helped, especially when more data came in and we're able to fine tune our mitigation processes.
Yeah, yeah. And I mean, I agree with you on that. It's important to say that we don't know, here's what we know, here's what we don't. And we're going to keep updating you. That's classic risk communication 101. If you're in industrial hygiene and have read the Synergist magazine of AIHA, like I have way too long, you probably read that from Peter Sandman, who has written extensively on risk communication and the importance of that. But it was a constant challenge, of course. And so Beth, now you're batting cleanup on this one. So what about for you on this whole issue of the different groups, the different populations, the stakeholders, and the ever-changing landscape?
Well, I really like what Kay said, because I think that one of the things we're vulnerable of doing is losing trust and losing credibility in an environment like this, where if somebody feels like they don't believe you because you're holding out information, or you become someone who isn't trusted, it really is damaging in how we're responding to the pandemic. And so we have a challenge in our particular area of multiple languages. We have Haitian populations. Not only do we have Spanish speakers, and so we had to also. I was very grateful early in the pandemic. Actually, the CDC did a phenomenal job of providing us materials in multiple languages, and then we had some that we had to tweak a little ourselves to apply to be able to strongly communicate with our constituents. So that was definitely a challenge. And I want to say to Elena, so it's not only maybe facilities individuals who don't either have access to email, students don't read email anymore. And so we had to get creative in the multiple constituents. So, our faculty and staff may read the email, but I found that we had a big gap in our communication and connecting with the students. So we had to get creative in the way we used social media and other platforms to engage them, because their information that they processed was so wrong and backwards, and they were twisted. And so I found that I wanted to engage in town halls. I wanted to provide platforms to be able to ask questions. And sometimes I was just shocked at the questions they would ask. I was like, where are you getting this? And you think you're pushing out good data, and it doesn't connect or land. And so it was definitely a real challenge working with all these different groups. And then also, I think Elena and I have a similar experience in, there are also groups that couldn't work remote. So you have basically sent home all these workers, everybody's working remote. Well, everybody assumes everybody's working remote, and they're not. You can't repair a leak in a roof remotely. You can't repair a clogged toilet at a distance. And so, you're having to work with these groups. And then, as you mentioned, Jonathan, going into the risk perception thing, helping them understand that we need them there and that we can help them provide work in their environment safely. And that even while saying, but everybody else go home. It's unsafe for you to be here. But now I want you to come and stay and work, and we're going to protect you, and you're going to do it safely. So it's, right. And then their perception of the risk that they're at risk to get COVID because of how unknown the situation is. And yet we're telling them, we need you to be here and work.
Right.
So.
Yeah. in my head, I've got like so many different directions I want to go, but we're really touching on a great area. And Ray asked in the Q&A, how do you deal with the ever-changing recommendations from authorities like the CDC and determine also what is quote unquote real science versus, and he put politics, and that's fine, but misperceptions, other perceptions, all of this. And, this is something that we all talked about in our meeting leading up to this. And so I think we've started to touch on this. So instead of being totally sort of asking you to say what you just said, let's go into this area of risk perceptions, because I think from our perspectives, that's really one of the biggest challenges that we all face is and I've said this so many times to people, COVID demonstrated for us that our risk perceptions vary widely and wildly, right? And so let's just talk about that. And I can't remember who first, so I'll go to Lou first. How did you deal with that? Any challenges, and of course, any successes in that area, Lou?
So I don't think we dealt very well with it. Probably we're pretty similar to everybody else. I mean, I think what we learned from it was that we should plan for whatever the next crisis is. We're going to have a lot of unknowns, and we're going to have a lot of changing of the practices or the requirements or whatever in there. And therefore, and it gets a little bit, I think, to what actually Kay and Beth and Elena have said a little bit each other is sort of coming up with a communication that helps people in our community understand what risk means, what risk assessment means, and the unknowns, and that the unknowns are to be expected. It's not all of a sudden a shock or we've made a mistake or something else. And we have to, and Beth, I think, said this early on, we have to develop credibility and trust within our community. And you do that over long periods of time before the crisis comes along. One of the things we regret that we didn't do more is prior to the pandemic, our emergency management group had started to develop scenarios for us to go through with again, all the units. And I think what we learned from this is we need to do more of that so that we can be prepared for whatever the next crisis is.
Good point.
Good, thank you so much. Elena, you're next, please.
That was a great question from Ray. We didn't do as good a job in the municipality. We had older versions. So I started when I did weekly meetings with the departmental points of contacts. I'd say, this is what we know right now. And it took us a little while to get a handle on that because people would save like the internal contact tracing that we need our managers, the information we need them to provide. They would still save the older version. So we had to put everything on SharePoint and put an actual date in the title, and that really was a difficult thing because things were changing so rapidly, as Kay and Beth and Lou has said. So we used SharePoint and basically said, do not save anything to your desktop or the computer. Just go to the SharePoint site whenever you need to look for a version, which was challenging for our people that work in.
Cool, good. Beth, what about for you?
Yeah, so I think I'm going to take a slightly different twist on it. So I think it's very challenging. You're first of all, you're never going to make everyone happy, and for somebody who's a people pleaser, that's very hard. And so you're going to have people that perceive this, as no big deal, and then people who are like, oh my gosh, we're all going to die, and you can't make what are you going to do with those individuals except try to educate them. And so my twist here is that while I think we had room for improvement, one of the things we did very early on in the pandemic, and I'm so glad I stumbled into this and I did this, is I requested a COVID coordinator from every single college, every single department, and I met with them every single week. And I think what that did was it empowered those individuals with information that was current and accurate, that they could be the resource in their department for the current most recent information. And you all remember when the CDC, it was 14 days And then it went to 10 days. And everybody was like, whoa, you want to kill us. You want to spread the virus. You're not being safe, right? And how do you educate? So, I met with this team and I said, there's science here. There's research that's been done. We know that in the majority of cases now, in a normal course of COVID, by day 9, the research is showing us individuals are no longer producing active virus. It's no longer infectious. It's no longer replicating. We have science behind the CDC's public health decision here. This isn't political. This is science. And empowering individuals with data and science to then be able to, and I used to tell them we weren't having cocktail parties or having any live events, right? But I wanted to educate them all to use the correct terminology. So we talked about the correct terminology of words, efficacy versus effectiveness in viruses, what quarantine is versus isolation. So I wanted all my individuals to be really well versed. I said, you're going to entertain all your friends at cocktail parties with your knowledge. But that was our approach. Our approach was, let's empower individuals with the current and most accurate information. And then they would do checks. Are we still doing it this way? Is this still right?
Cool. I think that's great. Trying to work through people, your coordinators, who then are people from those departments that others can, that they know and feel closer to and able to trust. And it looks like something happened. Oh, there's Kay. He's back again. Hey, Kay, we thought we lost you for a second, man.
Yeah, sorry about that.
No, that's okay. You came back right in time. That's perfect, as a matter of fact. So what about from your perspective, and of course, as our medical professional here, I think it's also important to talk about that, because of course, for you, you're trying to treat people, you're trying to help your entire campus and maybe community, the science of it, and yet people have these risk perceptions all over the place.
Yeah, one good thing I had going for myself, and I shouldn't say that's myself, for my campus, is that we had a really great communication team, as well as one of the, I don't want to say the nation's best specialists here, but we have some really good specialists out here. So the communication team coordinated with all the stakeholders as well as the experts, and you picked our brains so we could have an appropriate answer for anything that could come along. We would upload it, Q&As on websites. I think Beth alluded that students really don't deal with email, so they'll text, little town halls like this. We'll have surveys and we'll find out, okay, so what seems to be the question, what's scaring people more? What groups are scared? And then
I think
else in the community.
I can hear you now, Kay.
Okay.
You stopped for a minute there, but now I've got you back.
Okay. Sometimes we'll utilize the information that's targeted for, like, say, if individuals have issues, concerns about the virus or mitigations, we'll have like targeted town halls, kind of like something like this, Q&A, so they could actually ask us right up front. Now, there are people that you're not going to please them. There's people who just want the world to burn. You're not going to reach out to them, but you could try. But for us, it was basically just getting the information out, being very targeted, and also consistent. We were very consistent with our messaging. But I think that has helped us significantly.
Yeah, no, I think this is great. So let's also talk about what are the things, the different controls, and everyone knows that it's been ever changing. So checking in with each of you, for the people, the areas, the companies that you represent now, or whatever, the institutions, what are you doing now relative to vaccines, mandating, encouraging testing, masks, distancing, et cetera. We can't cover everything, but maybe you could kind of just quickly give us a picture of what that is right now in your area. And I'll start with Beth, please.
Yeah, so it was not a popular decision in the state of Florida, but my president announced early on that he was going to mandate vaccinations for employees and students. And so he decided that. I think Rutgers may have been the first school to make that announcement, and Rutgers announced they were doing it for students. And then shortly after that, Dr. Hambury announced he was doing that. He was making the same decision, but for everyone, all students and all faculty and staff. And no other employer in the state of Florida had made such an announcement. Nobody had done this. It was really a big sort of shock and awe moment. And then we were later informed, when I say later, hours later, informed by the governor that we could not mandate our students. So there was already large precedent from the EEOC. So we were able to continue with the mandate for our faculty and staff. So we have successfully achieved that. We're 98.7% of our employees are vaccinated. And so we have some exemptions, of course. We have individuals that are able to exempt. And we have a really high rate of voluntary reporting among our students. And so up until today, we've had a mandatory mask requirement on campus. So as of now, we will have mandatory masks in our classrooms, but we're relaxing the mask requirement on campus due to the robust response to vaccinations. So that's pretty much a snapshot of where we are.
Yeah, great. No, perfect. Elena, what about from your perspective, doing a lot of the epidemiology that you've been doing?
Well, I can tell you that my past two employers did not mandate vaccinations, and that's very concerning because every time a virus replicates, it can mutate. But the things that have been implemented are the work from home hybrid is here to stay. And masks are at least in the Pacific Northwest are mandated for employers when working inside and social distancing. And then this is maybe a little bit off topic, is a big flu push, a vaccine flu push, because this time last year we had issues with people thinking they had flu when they had COVID. So I think, provided that this year's flu vaccine gets the primary pathogen, I think that will help people determine what they actually have if they come down with symptoms. So really a huge flu vaccine push this year.
Yeah, and just speaking for myself, all of a sudden I started getting texts from CVS because that's who I use. Come in for your flu vaccine, and I'm like, oh my God, it's that time of year. And I went in and I got the flu vaccine, just same as I always do. So I mean, I don't want to get the flu. It's pretty bad. Right. Good. Okay. And Kay, what about from your perspective? What's going on? Be it UC Davis, and of course you have the medical hospital there. I'm not sure that everyone knows that. I know that, and I know that's some of what you were referring to about some of the experts that we have at Davis. But yeah, for your area, what are the things going on now for these?
So I'm not sure if I know there's a few Californians on this call. The governor signed an order. Basically, if you're healthcare, you have to be vaccinated or you can be unemployed. The university president, President Drake of University of California, signed a similar order that everyone has to be vaccinated if you're an employee or student. A combination of these two orders had increased vaccination compliance on campus. We're right now at 99%. As a consequence of that, and they're at the local level, my boss, the vice chancellor, has actually increased the mitigation by testing those who are vaccinated every 2 weeks, along with indoor masking and very robust contact tracing. Right now, our rates are like lower than any other area in the state. So I think our positivity rate is at 0.006% or something like that. probably like a positivity rate of one, probably half of one per 10,000. But we're sitting pretty here in terms
That's
of COVID.
nice. Yeah, no, I mean, I was at Davis when the pandemic started and we were shifting as we went. And I think we had one of the first cases, as a matter of fact, in Davis that was not travel related, as I recall. And everything was so novel, so new, as Kay and others have said here, and we all know. Lou, I don't want to forget you. And Kay mentioning positivity rates. I think that you don't have to go right there, but I think MIT also is doing well in that regard. Is that right? Well, you're on mute, Lou.
But you didn't hear what I said the first time.
No, I'm not good at reading lips. Sorry.
I actually, yes, you're correct. Our positivity rate is 0.1, I think. We're doing most of the things which everybody else said, and I'll go through them. But in the context of getting back to sort of communication and maybe things I wish we had done differently, about 3/4 of the way through, I read an article from Virology out of New Zealand, and they talked about COVID-19 in the context of the Swiss cheese model, which most of you are familiar with. And I wish we had used that because it's a great visual. And basically to say to people, nothing is 100% foolproof, but here's what we're doing. And here's what MIT did. We've always been telling people, if you're sick, you should stay home. But then we started testing so that we could at least see whether people might be positive but not have symptoms. Require masks, and we're still requiring masks indoors everywhere at MIT as well. We are working remote wherever possible. That might become the new normal. But Beth pointed out that facilities people, lots of people still have to be on campus. And in our case, I expect in a lot of university cases, people needed to come in and do research. We had lots of researchers who were doing research on COVID-19 and infectious diseases, as well as government research that needed to get done. So we had a lot of people that were coming on campus. We practiced social distancing, probably to a fault, where we actually had models that our faculty developed, which would indicate how many people could occupy a particular space based on the ventilation and some other factors as well. We brought the HVAC systems up to the minimum standards required by ASHRAE and others, and we ended up with a few places where we couldn't occupy because the ventilation systems wouldn't do that. And instituted cleaning twice a day by our facilities folks, and restrictions in how many people could be in the toilets and et cetera, like that. And now we are testing once a week for people who commute. And if you're living on campus like students, it's twice a week. And as I mentioned, the positivity rate has been below 0.1 for the last couple of months.
No, that's great. That's great. Yes, the whole issue of, is it safe to go in the bathroom, given that they're detecting particles of the virus in the feces, right? And which became a very good way. I know that the University of Arizona and others have done this work where they collect samples, the sewage, and you start to look for signs that maybe something's going on in this building, in this dorm in particular, or this area or whatever. So yeah, very good. I actually was a panelist for us a year ago or so on we called it, I think, bathroom safety, which was a very interesting title for something. So let's continue with this area, and I'm going to the Q&A, and I think we're just going to continue along these ways of having a conversation. The questions seem to really get at areas that we're already talking about. So everyone attending, please do feel free to post your questions in the Q&A. We're all watching it right now. So Mary asks, so looking on thoughts dealing with COVID fatigue, especially in students and maybe on a fully vaccinated campus, right? So at least they think we're quote unquote all vaccinated. Why do we have to keep wearing these darn masks? And communications, as I think you're getting at, have become, sort of background noise. Students don't necessarily always want to look at emails. I don't always want to look at emails, I'll say, right? And student or not. And so, how do we deal with that? I don't want to say combat it, but how do we deal in a positive way with so much fatigue? And just one quick sort of framing of it, as I think at least the five of us know, because we've talked about it. The human brain is a fantastic processor, but it really likes simplicity, and it likes to come down to one thing and not necessarily deal with a number of factors. At one point during this, I totaled it up, and I think I stopped at about 40 different COVID factors. Our brain gets overwhelmed at more than about 3, right? So it's like, hey, vaccinated, so I don't have to do anything else. Yet, to Lou's comment, for those that don't know, the Swiss cheese model, Swiss cheese has holes in it, right? And so I even read an article that used it today. If you throw one slice of Swiss cheese down, you can see below it. You can see through it. So the hazard is going to go through it. But if you keep throwing enough down, the holes will stop lining up, and you'll eventually stop being able to see through, meaning great, or the hazard, like a sharp pointed pencil, go through a series of lined up holes. So I think that's enough from me. So let's talk about that. And again, I cannot remember who went first or whatever. I'm going to go to Kay this time first. Yeah, you're off mute, Kay.
Oh, sorry. I guess the universal internet's kind of acting up today.
Oh, okay.
So to address, I assume the question was in regards to the question that was posted earlier.
Yeah, so like, fatigue, and we zone in on just one thing. How do you help students or others understand that we really have to keep at it, and there's more than just one thing going on at a time?
Once again, it's just repeating the message and simplicity. So it's funny, you, Jonathan, and Lou talked about that Swiss cheese model. I actually took, the New York Times actually utilized a graphic from that article, and I just used it in my presentations because it's simple, right? Mm-hmm. It's a very simplified way of describing what really is going on. And I think that would be the best way, is just to keep reminding them that the vaccines are great. They're just not 100%. Nothing in life is 100% other than death and taxes. Just hammer home with that, and also remind them there are individuals who are immunocompromised. They get a vaccine, they're not going to elicit an immune response, or there's people who can't get the vaccine, like my 2-year-old kid. You have to see it as what I do sometimes is tell them this is a social contract between you and your fellow man. Not all of us want to wear a mask. I'm actually glad to be able to see individuals' faces here on the Zoom, but I know that there are vulnerable populations that masking will help protect. So hopefully a combination of repeating the message and trying to elicit them to listen to their inner humanity. Be good to your fellow man or woman. And hopefully that will alleviate a little bit of the stressors and the fatigue that's going on with everyone else.
Yeah, great. And we're going to go through this, and then we're going to do a poll on topics and such, and we'll continue with our questions, whether they're the ones that we have here or the ones that you all want us to ask. So please do feel free. Elena, what would you say to this area and Mary's question?
I think it's a great question. I would echo what Kay said, but also and remind people that the people with comorbidities have higher mortality and morbidity rates, as well as we've seen breakthrough cases, although they are rare, with people who are fully vaccinated. So I think echoing a lot what Kay said, but to remind people that people have a more severe and potential fatal reaction if they have comorbidities, and you wouldn't necessarily know who has a comorbidity.
Right. No, exactly. Yeah. Lou, what about from your perspective on this question?
So I think, it's already been stated about just frequently giving the message. But I think what's also just as important is who delivers the message and how it gets delivered. And in the ideal way, I couldn't do this, but in the ideal way is to figure out different ways to give the same message. So you change it up a little bit to get interest. I like what Beth said about empowering some people to go out into the various groups. So that would be one way of getting the message out from peers. Another way, which Kay would like, but Jonathan, you and I probably don't like to admit it, but physicians have more credibility than industrial hygienists. And so, the message, again, it's who the message comes from and their credibility and trust as well. But frequently and in different mechanisms, but the same message, consistent.
Yeah. And I agree. Trust. And I will tell you this, I think we all know it. Trust always wins against confidence, right? Because confidence is about competence, is about skills, and trust is about who you are as a person. And often, how do I know you, right? And I think we all could speak at this at length. Beth, why don't you wrap up this? We'll launch the poll and continue.
Absolutely. Well, aside from having a terrible craving for cheese right now, I don't think I can top off my esteemed panelists and their comments. And I'm not suggesting we go down this path, Jonathan, but Mary's question triggered for me my greatly increasing concern over the mental health issues we're seeing from COVID. So when Mary wrote about, how are we battling COVID fatigue, I'm immediately actually concerned with how are we handling the sort of mental COVID fatigue that we're seeing. We're seeing a greater need, a burden on our psychiatric support programs at the university. Our students are not dealing well coming through the pandemic. So don't need to go there, Jonathan, but that could be my 2 cents is I think the COVID fatigue is not just that our messaging is falling on deaf ears right now. I think that we're going to be dealing in the future. So sort of like as we come through this storm, right? You so aptly named this this talk. As we come through the storm, I see we're going to be facing significant challenges in academia as far as bringing our students back up to the robust education level they need to be. They've suffered academically the past 2 years from COVID. I see mental health challenges that we're going to be facing, and I think that's also not just in our students. We're going to see it. Our human resources teams are going to be stretched to cope with that as well.
Yeah. Well, Chris, go ahead, please, and launch the poll, sir. And we do really value. Thank you, Chris. We really do value everyone's attendance and input on this. Panelists, sorry, you can't vote on this, but you can certainly take a look at it and let me know personally offline what you would vote for. You can certainly, but everyone that's attending, please do the poll if you would. And if you ever wish to reach out to me personally with some thoughts of your own, please feel free to do so. It's always jonathan.klain@bioraft.com. And Beth, your comment of Jonathan, we don't have to go in this direction. That's like that sort of neuroscience. If someone says to you, okay, right now, don't think about an elephant, automatically your brain thinks about an elephant. You just can't prevent it. So telling me you don't have to go in this direction is like, but I really do want to go in this direction and I really should. And it is a very important point here. So I think, I do think that it is very valuable for us to go in this way. So hopefully everyone can do that poll or has done that poll. What I will add is one word that I know will resonate with my panelists very well, but also our panelists. I think of you so dearly, you're my panelists, but also everyone out there. If I had to give one bit of advice and it was just one word, I'll ask, you know what, let me do it this way. Let's go around really quickly. What's the one word that you would give for advice in dealing with this? Beth looks like she's deep in thought, so I won't go to her right away. Lou, my dear friend who's another IH, I'm going to go to you first and see if we line up or not.
So it's only one word?
Yeah, I'm going to really, really push you. If you have to do two, I'm not going to, beat you up over it, Lou, but go for it.
Question everything.
Okay, good. All right, super. Elena?
Resilience. I think it's resilience. I mean, both for our support systems, our staff, and communication. So I think if I had to pick one word, to be resilience.
Good. No, these are great. You know how it is. And I was a former professor. There's no one right answer. It's whatever you think it is, right? Kay, what about you, sir?
Hope.
Hope. Oh my goodness. Awesome. Pandora's box. A big fan of Greek mythology here, right? There's always hope. It's like our dog. Our dog Drago, there's always hope that when you're making something at the kitchen counter, you will drop food on the floor, right?
Yeah.
All right. And Beth, what about for you?
My word is going to be listen. I think
Listen.
some people just need to be heard. They need to be able to voice their concerns. And so my word is listen.
I think these are awesome. The best part is mine is different. Mine is empathy.
Yeah.
Is have empathy for your fellow person, no matter how odd, troubling, unnecessary, different from ours, challenging, frustrating, whatever it is. I will say you almost can't go wrong by having whatever empathy you can for them. So let's talk about this. Let's talk about hope and resilience and empathy and listening and questioning. Those are great, one or two word responses here. I think I'll start with Kay and I'll sort of intro it. I was on the Compliance and Risk Council when I was at UC Davis, a rather high level thing. I felt very honored to be asked to join it. And we would usually talk about all sorts of things. And in one of the last meetings I got to attend before I left UC Davis, everyone had the same feeling, especially I think it was the Dean of Students who introduced it. And I can't remember the gentleman's name now, sadly, but it was, we are seeing mental health crises. Counseling was seeing it. Okay, I'm sure you can talk about this accurately. I'm sure all of you can. And so it was huge. Mental health is always so important for all of us, but for students and for others who are really, stressed out and anxious about this. So maybe just, a minute or so as usual from each of you. Let's really dive into this. Kay, do you mind starting us off, please?
Yeah, so hope. Well, this pandemic is unprecedented, to say the least. And as Americans, we're not used to this level of restriction in terms of the mitigations that we've done to address the pandemic, along with just how this has modified her day-to-day living with no end in sight. A lot of individuals who are already a little vulnerable mentally, this kind of put them over the edge. And those who, no matter how strong you are, it was taxing. And that, in my profession, a lot of providers, nurses, doctors, they have dealt with a big brunt of this pandemic, and it has affected them. But the one thing that has kept us going is that we always felt, and including myself, that we would be able to at least put a dent in this, at the least, and at the best stop it. And when the vaccines came out, that's when that little light at the end of the tunnel started to show up. And it seems like, yes, there are some news that comes out that says there's X amount of people dying, there's a new variant, or two or three, but in general, we're still progressing in a forward momentum way.
Yeah.
And that is in itself better than any antidepressants or whatever vice that anyone in this call could ever think of.
Sure.
So that's why when you asked me, this was like hope. That was the very first thing that popped in my head, because that has been helping me through, and my colleagues as well.
Yeah, no, hope is a good one. Without it, things are pretty dark. I will definitely say that. Yeah, Elena, what about this whole area and serious challenge of our mental health issues?
I think it's very real. I think that, and I don't want to jinx us, that in the Pacific Northwest and in California, when we had the wildfires plus COVID, we had to do a 180. Instead of letting a lot of outside air in, and it was just the outside was where people were, meeting their friends and family and getting some stress relief, and then the complete opposite where you couldn't be outside. That I think the long-term effect of the mental health impact that's had on people, I don't think it's known. I think the reason I picked resilience is that and I loved Kay's word, is that there is light at the end of the tunnel, but we have to continue to find ways to support each other, support the people that have to be in the workforce, and if it's Zoom meetings, if it's virtual happy hours, which is what I've done with some of my staff, that it's just that I think really supporting each other through creative methods.
Yeah, I agree. Creative methods, very, very important, whatever we can do. I've been to a bunch of virtual happy hours. Don't really consider myself a drunk per se, but I will say that they've been very helpful in many ways. The social aspect in particular, of course, regardless of the beverage of choice. Lou, what about for you on this very serious challenge that we're all facing with mental well-being?
So, I think the first step, which we've all taken, is to recognize that it exists. And the next step is probably, particularly at a large institution, is to recognize that it's different for different people. Mm-hmm. So when this occurred, we had graduate students that were finishing up their doctoral degrees. What was this going to do to them? Postdocs that were looking for their next position, junior faculty that were looking for promotions. Students wondering, what was going to happen to them as well. And then on the employee side, just everything became 24/7. And it wasn't the expectation, but people felt the expectation was I needed to be available 24/7 and respond 24/7. We're now at least kicking around the idea of having, at least within my office, having a common footer that says, I am sending this email at a time convenient to me. Please respond at a time convenient to you, unless it's an emergency. One of the things the Institute did, you mentioned happy hour, the Institute provided a lot of online resources, exercise classes, courses, games, and encouraging people to do those and not work 24/7. And although you couldn't travel anywhere, take vacation and do something around the house.
Yeah. So
again, I regret that we didn't think about these things a lot sooner in the pandemic.
Oh, absolutely. And Beth, you're the one who introed this, and I appreciate that. I thank you for it. So from your perspective there on mental well-being, what would you say to wrap up this one?
Yeah, well, I really appreciate the sharing on this topic. Really phenomenal answers in the chat as well. So I think, what's there to say other than, I think for me right now, it's kind of like when there's a terrible emergency, and I have a renewed respect and appreciation for emergency responders. When I was going through the challenge of trying to communicate this message, I had a newfound respect for those that work in communications. And so I think where I'm at this moment, Jonathan, is I just have found myself finding a tremendous amount of respect for those in the mental health field. And I'm not in that field. I don't feel equipped whatsoever. But I think it's important we all recognize the impact of this, and that we need to find a way to support people who are going through challenges and direct them to resources. And I'm grateful that my university has excellent resources available. And all my case managers, I have public health graduate students that help me manage cases. We've all been trained to kind of be in tune for that, and to be able to steer them to those mental health resources for those that are not coping well, either in isolation or whatever their situation is. But so I'll just part on saying I have a tremendous amount of respect for individuals that have dedicated their lives to that field. And I think it's important we're all recognizing that this challenge is a consequence of the pandemic.
Yeah, no, absolutely. Well said. Well, we have hit past the hour. There aren't additional questions in the Q&A. We've been addressing it in the flow, which I think was really very helpful for everyone here. So, but I do want to give our panelists one more opportunity to share whatever it is. You can go in whatever direction on this overarching topic of the pandemic and the Delta variant and everything we've been talking about. It's sharing of a resource, a tip, your thoughts on this. One last thing, and then I will wrap it up and say goodbye for all of us within the next handful of minutes. So I will start with Elena.
I think partnerships have really been critical, but partnerships that perhaps we hadn't had before with local public health professionals, with my colleagues in higher education and other municipalities, and really sharing of information. So if there's one really positive thing that came from COVID, it's the renewed partnerships across multiple disciplines.
Nice. Thank you so much. All right. And Beth, you're next, please.
Sure. So of course I'm going to speak to Shima, the campus safety. Yeah, of course I'm going to go there. I was extremely grateful that individuals leaned in. We were all sharing, how are you handling this? How are you handling that? We were having town halls where people were sharing information. I just was really grateful that Shima as an organization, as an association, leaned into this problem and coordinated all of us to try to share information. And then if you all are kind of virology nerds like I am, one of my favorite things that got me through the pandemic was a podcast called TWIV, This Week in Virology. So it's not all about COVID, but Dr. Daniel Griffin gave COVID updates. And so TWIV got me through the pandemic, and I still listen to TWIV. And that was been an amazing resource to me. So if there's ever another pandemic, jump on TWIV podcasts.
All right, will do. Thank you, Beth. And you have a fan, Daniel, I think, gave you kudos in the chat. That's very kind. Yes. Kay, my good friend Kay, one final thought, please, sir.
Before I start, Beth, how do you spell TWIV?
TWIV, just like it sounds, TWIV. This week. Okay. This Week in Virology.
Okay.
Yeah.
Sorry,
fellow nerd. You got
share
it with everybody.
My final thoughts. Well, one good thing about COVID, it has changed the what is considered work. We negotiated a contract between employee and employer. So what could have been done in person really could be done at home. Not all the time. Like, physician, I got to see patients, but it has opened up the possibility of remote telemedicine, which was kind of like in its infancy. But that's one positive good thing that came from this pandemic, along with it kind of reinforced that we are a community, and that we cannot fight the pandemic by ourselves. We have to get either other departments, other organizations, and collaborate the resources. No one is a silo. And that is one of the things that I along with the renegotiating the concept of employment is what I believe is a positive
Great.
force from this pandemic.
Yep, absolutely. Telemedicine. I saw my doctor both in person and telemed. Counseling, to double down on what a lot of you have said. I'm a huge fan of counseling. It's benefited me tremendously. I feel like if everyone were in counseling, the world would be a happier place, right? All right. And Lou, my dear friend Lou, for many years here, please, what would you like to say as the final words? And then I'll do our outro.
So my final thought comes in two parts as a way to get two things in, I guess. First, for everybody, on here, what I would recommend is make sure that you really understand your organization, because all organizations are different. So understand how your organization works, how they communicate, how they collaborate, and that helps you to build the relationships that you'll need going forward. And the part two of that is, for all of us, is let's make sure we understand the lessons we learned from this and change our behaviors and our patterns and our programs as necessary. So when the next crisis, and there will be one for all of us, when it comes along, we're in better position to handle it.
Absolutely. I'm going to share my screen as the last thing. Here was what people put in the Menti poll. If you could change one thing, visible in the air to our eyes, less virulent, transmissibility, its transmissibility to zero, the utter misinformation gave EHS folks superpowers. That's pretty neat, I like that. Make it gone, and delete zonicity. So on that fun technical note, thank you all so much. Thanks so much to our wonderful panelists for donating their time to this and their efforts and their wisdom and their experiences. I think it's been a fantastic conversation. And thank you all for showing up. It's always wonderful when you come and contribute to the discussion. And so my final word is talk with people individually as much as you can. Have those one-on-ones, those heartfelt moments. Tell each other stories, listen to each other's stories, and see what sort of bonds and relatability and benefits you can build. And I guess I will say I love what all of the panelists have said, but I will end on my dear friend Kay's note of there is always going to be hope. Thank you all so much for coming. I hope you have a wonderful rest of your day, week, and everything else going on in your lives. Take care.
Thanks, Jonathan.
Thank you all.
Thank you, Jonathan.
Bye-bye.